All right, let's dive right in. In this guide, we're going to talk about something that goes way beyond just managing symptoms. We're talking about actual erectile restoration by taking a close look at the medical-grade P-shot.
So, you've probably asked this yourself, right? When it comes to ED, are pills the only game in town? I mean, they're everywhere you look. But here's the thing, they might not be the best answer, because they could be completely ignoring what's actually going on.
And that really sets up this classic showdown. It's a tale of two totally different approaches. On one side, you've got the pills, which, let's be honest, are just a temporary mask for the symptom. And on the other side, you have a method that's all about true cellular regeneration, fixing the engine, not just taping over the check engine light. So to really get why this is such a big deal, we've got to look beyond the pill. We need to dig a little deeper and understand the root cause of the issue. And here's the key takeaway. Erectile dysfunction isn't just a mechanical problem. It's actually a signal. It's your body telling you that on a cellular level, things are starting to break down. We're talking about the gradual wear and tear on the very blood vessels and tissues that are essential for everything to work properly. So it kind of makes sense, right? If the problem is tissue breaking down, then the solution has to be rebuilding that tissue. And that's exactly where the P-shot comes into the picture. It's all about tapping into your body's own amazing natural healing power. The P-shot uses something called Platelet-Rich Plasma, or PRP. I know, it sounds super scientific, but the idea is actually pretty simple. We take a little bit of your own blood, and we isolate and concentrate all the good stuff, the healing proteins and the growth factors. This creates a really powerful natural serum that basically tells your body, hey, time to start repairing things in here. And once that PRP is where it needs to be, it gets right to work. It's like a construction crew for your body. It starts stimulating new blood vessel growth, it repairs damaged nerves, it even helps clear out tiny bits of plaque that are clogging things up. And the end result of all that work, increased firmness, better sensation, and just healthier tissue all around. Okay, but this is a really important point, so listen up. Not all P-shots are the same. Not even close. Who does the procedure is maybe the most important factor of all, and this is what we're going to call the oncologist's edge. And I get it. You're probably thinking, wait a second, a cancer doctor? For this? It sounds a little strange, but stick with me, because the reason why is actually pretty incredible. It all comes down to one thing, expertise in tissue damage. Think about it. Radiation oncologists are, quite literally, the world's leading experts in fixing the most severe kinds of tissue and blood vessel damage you can imagine. They understand how to repair these delicate systems on a level that nobody else does. And this quote just nails it. A specialist isn't just doing an injection. They're engineering a full recovery plan. It's a protocol that's specifically designed to repair the entire vascular system from the inside out. It's a whole different level of care. Now, a huge part of that engineering is getting the concentration just right. To actually trigger real, meaningful tissue regeneration, you need a platelet concentration that's 4 to 6 times higher than what's normally in your blood. If you don't hit that number, you're just not going to get that powerful healing response. It's that simple. And that concentration, that 4 to 6 times number, is the massive difference between a medical grid procedure and what you might find at a spa. Medical grade means you're getting that optimal dose, delivered with precision in a super safe environment. The spa grid version? Well, you're often getting a weak, watered-down solution that doesn't do much of anything, and sometimes it's done with a blind injection, which is just plain risky. All right, so now that we know why that quality and expertise matters so much, let's pull back the curtain on the procedure itself. What actually happens when you go in for this? Let's just get right to it. The number one question on everyone's mind. Does it hurt? And the answer, thankfully, is no. A really effective double numb protocol is used. It starts with a strong topical cream and then a very targeted nerve block. Because of that, most men say they just feel a little bit of pressure, but not actual pain. It's a huge relief. The whole thing is actually really straightforward and breaks down into 5 easy steps. First, a quick blood draw. Nothing crazy. Second, that blood is spun down to get that liquid gold, the concentrated PRP. Third, we apply that double numb protocol we just talked about. 4, the growth factors are injected with total precision. And finally, you'll be shown how to use a vacuum pump to help make sure that plasma gets everywhere it needs to go. So what are the key facts you need to know? Well, the entire process takes less than an hour. There is literally 0 downtime. You can get right back to your day. And you can resume all normal activities that very same day.
Okay, so the big question is Is this the right fit for you? Let's talk about who makes a good candidate and tackle some of those common questions.
You know, this is about science, not a magic wand, so it works best for certain people. It's really ideal for men with mild to moderate ED, or those dealing with Peyronie's disease. It's also a huge help for prostate cancer survivors. And of course, it's great for anyone who's just tired of relying on pills and wants to enhance their overall sensitivity and function.
So, when do you see results? Well, some guys notice a change pretty quickly, but the real magic is happening under the surface. It takes your body about 3 to 6 weeks to build all that new healthy tissue. That's when you see the peak results. And from there, you can expect them to last for a good year to a year and a half.
Which, of course, leads to the next big question. Is this thing permanent?
Well, the repair it creates is 100% real and it is long-lasting. But the aging process is also real, and it doesn't just stop. So what a lot of men find is that an annual booster treatment is the perfect way to maintain those great results and stay at their peak year after year.
So what does this all boil down to? It's this. You don't have to just accept declining function as something that's inevitable. The science is here. We can do more than just put a Band-Aid on a symptom. We can actually repair the root cause. It's a choice between managing the problem or rebuilding. The real message is stop waiting. It's time to start regenerating.